Alright, so today we're going to learn a little bit about conscious choking and how to help someone if they are choking. Can you guys see the board okay, or should I turn off like 1 second? Okay. Alright, so I'm going to go through, there's 3 steps. I'm going to tell you guys what the steps are and go through them, and then we are going to do it together, and then I'm going to have you guys practice on your own. Okay, but first, before we get started, I want you guys to imagine a situation that I'm going to read out loud, and I want you guys thinking about what you would do if you were in that situation, okay? So, alright. So, I'd like you guys to close your eyes and imagine you're in a restaurant with your best friend, okay? You're enjoying an excellent meal, and then suddenly your friend stops talking mid-sentence. And you're looking at them and their eyes widen and they look as if they're trying to tell you something, but no sound is coming out and they're not making any sense, and they start waving their hands around and motioning frantically, and then your heart starts beating faster and you have a sinking feeling that they are choking on their meal. And then their hands go to their throat, and so they're like grabbing their throat, and you look at them and they're not breathing anymore. Okay? Alright, so open your eyes. Now I want you to turn to a partner. You guys can do a group of 3 and a group of 2. And just kind of talk about what you would do if you were in that situation. Okay? Alright. You can go ahead and talk for just like 2 minutes.
What would you do? Go over to where they're at, and there's this fancy. I would put my fingers on their sternum and then down 3 fingers.
Oh yeah. Wow. I don't know how to do it, but I'm just gonna call someone. Who knows about the first aid?
What? That one is CPR. Oh, and they're choking.
So the thing. All right. Awesome. Okay. So can I have this group tell me just like some of the things that you guys talked about in your group? Like, what would you do?
We said that we would try to hit them on the back so that the food would project out of their mouths. Try the Heimlich maneuver and call for help.
Awesome, good job. All right, anything here?
Pretty much the same. I think if you said that they stopped breathing, right? So I would just yell to call 911 and then go and try to do that.
Awesome. Thank you. Okay, so you guys all have elements of like really good things to do when you're in that situation. And so just like a little background, one of the reasons I'm teaching this is because like I'm a lifeguard, and that's one of the things that we learn at the pool. And when I was younger, at dinner time, my grandpa started choking on his dinner, and like no one knew what to do, but my grandma was a nurse, and so he stopped breathing, and she like did the Heimlich maneuver, which is what they used to call it, and like a piece of sausage like flew out of his mouth, and like so that's a skill that she was able to use in that situation. So it's something important to know.
So they changed the name, sorry?
Oh yeah.
They don't call it that?
They don't call it that. They used to call it like the J thrust or the Heimlich maneuver. They don't call it that, and they kind of switched it up a bit, which you will see. And this is coming from Red Cross, like American Red Cross, so I'm teaching you like correct information, I promise. All right, so this is our lesson objectives for today. Amy, would you be able to read the first one, please?
Yeah, sure. Well, we'll be able to identify the signs of a person who is conscious and choking.
Awesome. And Loki, can you read the second one, please?
Will be able to know and accurately perform the 3 steps of aiding someone who is conscious and choking.
Okay, perfect. All right, so I'm gonna give you guys some papers here. So it's just like a fill in the blank so that when we're going along, you can fill it out, and that way, like, you can refer back to it afterwards. No problem. All right, so we're gonna go to the first step, which is conscious choking. So right at the top of your paper, it says conscious choking, and there's 3 spaces.
Is that the
Yes.
name? Conscious choking?
Well, that's the name of the,
To the first one.
yeah,
Sure.
because there's unconscious choking
Oh,
and
okay,
stuff like that.
okay.
But it's actually just, instead of the J thrust, it's called the abdominal thrust, which we'll look at afterwards, but yeah.
Sorry.
No worries, no, and questions are awesome. Okay, so for that first space right there, so there's 3 things that happen to someone when they're choking. And so in our little scenario earlier, they were having a meal and they stopped talking, and so that's one of them. Because your airway is obstructed, you can't talk, you can't cough on your own, and you can't breathe oftentimes. So one thing that differentiates, if your friend is choking but they're like, hey, I'm choking, you don't do anything. You don't hit them on the back, you don't do the Heimlich or anything, because they can just cough it out on their own. The only time you would do this is if one of these 3 things they can't do on their own. So if they can't cough anymore, they can't talk or breathe, that's when you would do this. Okay. All right, so the first one right here that's super important is if they can't do one of these 3 things, that means that their airway's blocked, and so you should probably call 911, which you guys mentioned, which is your first step. And then if it's a friend and they're really like just need their help, you can just like go ahead and help them. But usually you want to ask permission first. I know it's kind of weird, but it's just like a thing. Okay, and so the first step here is to give 5 back blows. And so, but the first thing to do is to bend them over like that, because you want to use gravity to force the object out of their mouth. So you don't want them standing up, you want them lower so that like it'll come out naturally. And so you hit them on their back like a baby, but you use the heel of your palm, okay? And you hit them like right in the center of their back, like right here. So you want to always make sure they're bent over, and you give them 5 back blows, okay? Does that make sense?
Mm-hmm.
Yes.
What if they're too big and you can't hold them like that?
So you don't have to support them with that hand.
No, oh, okay.
They can bend over.
Oh,
What my grandma did was she put my grandma over a chair.
okay.
So that's like one way that you can like hit them without them like falling over if you can't hold them up. But like with babies, you can like support them. So babies, you hold them upside down. But anyways, there's a whole. So yeah, just bend them over, or if like a table or something that like helps you. So yeah, 5 back blows with the heel of your hand. The next one is 5 abdominal thrusts, which is similar to the Heimlich maneuver, except for they used to tell you to go in like a J, but you don't really have to do that. You just do like 5 quick upward thrusts, like towards you, because you're standing behind the person, so you kind of do it upward, but the Heimlich was a little bit different, but they call it abdominal thrust now. I don't know why. All right, so you're just gonna make a fist with your hand, and then you want to put your thumb side like right above the person's like belly button. So their belly button's here, and then you make a fist and you go like that, and then with your other hand you put it over top, and then you just like you're pushing the object out essentially. Okay, and it's 5 again. So it's 5 back blows and then 5 abdominal thrusts. And so they're quick and just like, you just want to get it out. Okay? So that's step number 2. Any questions? No? Okay. All right. Step number 3 is to continue care. So this is basically just an ongoing process. You would have already called 911, and so you just want to do this until there's 3 reasons. Either the object comes out, and they start breathing and they're okay again, or they can cough on their own, like forcefully, meaning that they can like try and help themselves and then you don't need to like hit them anymore. Or they start breathing again on their own. And the third is if the person becomes unconscious because you can no longer hold them up if it's an adult and they're technically laying on the ground at that point, and hopefully someone else would have come by that point that can help you with that. But this is just like basic stuff, okay? So you would just keep doing your 5 sets, 5 back blows, 5 abdominal thrusts, until one of these 3 things happens or the person's okay. All right? Any questions?
So if they become unconscious, you don't do anything?
You
just
do
lay
it
them
on the
down?
ground,
Lay them on the ground.
and you have to implement CPR because they would have not been breathing for a long time.
Okay.
So then it gets like complicated, and we'll teach you that next class.
All right.
Yeah.
Why specifically 5?
It's a nice ratio to like balance it out, and I honestly just think that 5 is a good number. 3 is like not enough pressure to like push it out, but you don't want to also cause damage, because like if you're doing it properly, you might be like with CPR, you're breaking ribs and stuff like that, so you don't want to cause too much damage in one area at one
Do
time.
they still do CPR?
Yeah.
Is this in like the same?
Yeah, like, yeah. Okay. All right, and so what to do next? So if you haven't already done so, then you call 911, and then there's like a whole thing on unconscious choking, and that's when you like look for the object in their mouth, but that gets complicated. Okay? All right, so what I would like to have you guys do is we are gonna go, I'm gonna show you like what it's supposed to look like, okay? And so, may I please have a volunteer? I don't want to like force anyone to do this. I'm not gonna attack you, I promise. I'm not even gonna like actually do it. I'm just gonna like show you. Okay, do you wanna come here, Amy? Okay.
But I just ate something.
Yeah. So we're gonna pretend that we're in a restaurant. Oh, you actually just ate something? I won't harass you, I promise. Okay,
Get
so
the garbage.
yeah. So we're in a restaurant and we start choking, and so one of the signs is a lot of people will go like this. It's just like instinctive, I don't know why, but like, and they're not making any noise. So remember, if they're already coughing on their own, then you don't do anything, you just encourage them to keep coughing. But if they go like this, then they're choking, and so, you don't have to, for sure. So let's say she's not breathing too. So one of the things I would do is ask like Aubrey to call 911 while I help her. Unless there's someone more qualified, then I know how to do it, so I would help her. Okay, so the first thing I would do is bend over, and you want to use your dominant hand. And then I would hit her 1, 2, 3, 4, 5. Okay, and then you can stand up. And then I would go like this, right above her belly button, and then 1, 2, 3, 4, 5. Awesome, good job, you can sit down. All right. Okay, so I'd like you guys to pair up, and then, on the back of your paper, you can turn it around, it should say victim, customer, victim, customer, victim, customer. Unfortunately, we are odd, so I don't know, you guys can just do like a group of 3 and then a group of 2. I think that's probably best. And one can just be a passerby. So just, what I'd like to have you guys do is take turns practicing. So if it says customer, then you're the person helping, and if it says victim, then you're the person choking. And then if you guys need my help, or on your paper as well, it says what you should do. If you have any questions, let me know. And then so just run through it and take turns. And then afterwards, I'm gonna have you guys do it on your own. Okay? All right. Okay. You guys can stand up. Practice.
So how would we do this on our own? Like
So, oh no, I mean like do it together. So like you can go with Amy, and then you guys can like talk about it. Like what's the first thing you do? Is that okay? I know sometimes it's like awkward. No, lower. Yeah. So your belly button's right here. So you do it just above. Yeah, in like this.
So what happened? Did they teach you or did they inform you about a lot of people that if they're still moving and that they're okay, let them go to the bathroom?
No, it would depend on if they can breathe on their own. If they're like actually coughing and they wanted to go, I wouldn't let them.
You want to do the
But they could stop breathing and then pass out in the bathroom. So, like as lifeguards, we like to keep them like in our line of sight. So I wouldn't let someone, especially if you think that maybe they're choking on something that they could actually. Good job. All right, low-key practice.
Yes.
I'll come back.
I'm going to turn around.
1, 2,
What? Then?
Yeah.
1, 2, 3, 4, 5.
Good job. And so next time, when you do her back blows, make sure she's bent like all the way over.
Oh,
That way, like, because you want her head lower, so that like it's kind of forcing it out already. Because if she's standing up, then it wants to go down. So you want her to stand over so it wants to come out.
Does it matter if she's laying down? Like flat?
Oh no, you don't want them, because then they'll just be horizontal. Because it's probably stuck in their throat. And so if they're horizontal, then it will just block it. That makes sense.
So how does that work then when if they are unconscious, they're on the floor, you still have that stuck, and you're doing CPR. So if you're pressing, so you press the CPR right here, right?
Is that water
So
stuff?
then- Huh?
Does it matter if it's water or food stuff?
Well, if it was, it's most likely food because it's blocking their airway. And so if they're on the ground, like let's say you're doing an unconscious, I mean conscious and then they turn unconscious, if they lay on their front, you flip them over to their back. And then you do CPR, and it's supposed to help push it out, and then you're supposed to open their mouth and look for whatever it is. Normally you have gloves or like whatever, and then you look for it, and then you do chest thrusts, that's what they're called. And you chest thrust, and it's supposed to push it back up, and then you check. And if it's not there, then you do it again, and then you check until someone, EMS or someone, they have a suction thing too. Anyways, okay, so I'm gonna have you guys do individual practice. Okay, so what I'm gonna have you guys do is I'm gonna be your victim, and then you guys one by one, if that's okay, come up and save me. Okay?
Okay.
All right. So is it okay if we start with you, Aubrey? Okay. So I'm in the restaurant, I'm talking to you, and then I stop talking.
I'll save you. You guys really good for doing this. You go down like that. 1, 2, 3, 4, 5. And lift you up. And like this.
Yep.
1, 2, 3, 4, 5.
Awesome job. Thank
Like?
you. I'm perfect. It came out.
Yay!
Okay. Can we? Actually.
First is the front.
Oh yeah.
Kelly
actual thing. We don't want to hurt anyone, but it would be like super hard. Okay, Boki, do you want to? Tricky.
Okay, so excited.
Good.
It's like a back hug.
Yep. Yep.
1, 2, 3, 4, 5.
Good job. Good. I'm saved. Amy. Choking still. Nice. Good job. Awesome. Okay. Sheila, last movie. Good. Perfect. All right. Awesome job, you guys. Okay. So just to wrap up, I want you guys on the back of your piece of paper, I want you guys to think about this question. Sheila, can you read the question for us, please?
Sure. Are these skills useful for everybody to know, or only those jobs that require it?
Okay.
Whose jobs require it, sorry.
Yeah. So essentially, do you think this is like a waste of time for like everyday people to know? Do you think only like ambulance, EMT people should know, or like lifeguards? So just on the back, kind of write 2 sentences of like your opinion, and then afterwards you're just kind of gonna share with the class what you think about it. Okay? Alright, we'll finish writing whatever sentence you're on. And then have a few of you guys share what you wrote. I don't want to pick on people. Okay, Kelly, can you tell me what you wrote about the question that was on there earlier?
Yeah, I wrote down like I think this is very useful for everybody because sometimes you will, like sometimes for example, if you and your friends go to the restaurant or go to swimming or go to do something, and if this situation like happens very immediately, then there's nobody around you, then you will use this skill to help them immediately, like to help them to solve this kind of problem. So I think it's useful for everybody to need to learn it.
Okay, thank you. Amy, do you think you could share?
Yeah, I also think it's very useful to know this kind of skill because we don't know when the emergency situation can happen.
Yeah.
And if we know about this knowledge, we can help our friends, family, or people who we might not know.
Yeah.
So we can be savior.
Okay. All right, awesome job. Okay, thank you for sharing. And just in like the last minute or so, I I just want to fill out the first two parts right here. Okay, so Aubrey, can you tell me what the first line is right here for conscious choking, cannot cough. All right. Okay, Sheila, do you have the second one?
Talk? I think it was talk, I don't know. What was
Yeah.
it? Speak?
Right. Same thing. I was just. All right, and what's the third? Kelly?
Breathe.
Yes, good job. All right, and then lastly, there's a magic number. Boki, do you know what it is? Give how many back blows?
5.
Awesome. All right, so remember it's always 5. 5 back blows, 5 abdominal thrusts. All right, any questions? No? Okay, perfect. All right, thank you guys for listening.